Hello, everyone. Today's presentation will be on navigating telehealth and video conferencing. So what we'll cover the types of telemedicine services, example, video consultations, phone consultations, and messaging, the benefits and limitations of using telemedicine services, the steps for using telemedicine services, an example, creating an account, scheduling an appointment, or preparing for a consultation. And finally, we'll cover the tips for making the most of a telemedicine consultation. Example, being prepared with questions and sharing relevant information. So, types of telemedicine services. Telemedicine has been around for a while, but with the recent pandemic, it has become even more relevant and widely used. The key features of telemedicine include remote access to healthcare providers, remote monitoring of patient health, and secure and private communication between patients and providers. Virtual care connects patients to healthcare providers online via text, audio, or video call. Online doctors' consultations work just like in-person appointments with a family doctor or specialist. Through online virtual care, you can see a doctor online via text, audio, or video and receive an online prescription. So, video consultations. This is real-time interactive services approach. Patients get to consult doctors and specialists one-on-one through video conferencing. This approach enables patients to access doctors directly for consultations, just like traditional in-person visits. So, the benefits and limitations of using telemedicine services. Benefits are reduced wait times. Patients no longer have to stay in waiting rooms to see a doctor. Physicians can provide immediate diagnosis or treatments by connecting instantly to a scheduled meeting with the patient. So the limitations are the technical difficulties. Technical issues such as poor internet connectivity or technical malfunction can disrupt the flow of medical consultations and prevent patients from receiving the care they need. Another benefit is easy and accessible healthcare. There is no need to visit facilities for patients from rural areas and underserved locations, as well for patients with disabilities. Real-time interactive telemedicine is especially helpful. The limitation is lack of physical examination. Telemedicine also limits the ability of healthcare providers to physically examine patients, which can make it difficult to diagnose certain conditions. For example, healthcare providers may not be able to perform physical exams or take advantage of diagnostic imaging tests such as X-rays or MRIs during telemedicine consultations. Another limitation is insurance coverage. Another limitation of telemedicine is that all insurance companies cover telemedicine services, or not all insurance companies cover telemedicine services. This means that patients may have to pay out of pocket for telemedicine consultations, even if they would otherwise be covered for in-person consultation. So, steps for using telemedicine services. Using Maple. Talk to a doctor online. Log into Maple or create an account at that link. Select Get Care and enter your symptoms or description of your medical request. Something like right here on the right. So the next available provider will review your request and respond within minutes. Chat with a doctor slash nurse practitioner. Get medical advice, a diagnosis, and treatment online. So using dialogue. Through dialogue, you can get physical health service, mental health service, ICBT, employee assistance program. Their care team is available 24/7, and you can create your account as app.dialogue.co. So from the welcome page, choose chat with a professional to be directed to the list of services available to you. Choose a service that best suits your needs and then select Start Consultation. Then it will ask you a series of intake questions to get you in touch with one of their professionals and set up an appointment. So, tips for making the most of a telemedicine consultation. Let your health provider know if you need accommodations. Check your email for instructions. Test the technology before the visit. When using video, find a well-lit spot. Make sure your camera is steady. Reduce your background noise and write down important information. Here are some resources that you can explore. Maple, which provides access to Canadian licensed physicians for online consultation and prescriptions with delivery of medication to your door. Dialogue offers virtual consultations with healthcare professionals, including doctors, nurses, and mental health specialists. EQ Care provides virtual consultations with Canadian licensed doctors, nurse practitioners, and registered nurses, as well as access to mental health support. Telehealth offers virtual consultations with Canadian doctors, nurse practitioners, and mental health therapists. And CloudMD provides telemedicine services for primary care, mental health, and specialist consultation. Thank you for listening. If you'd like to learn this lessons with the Cyber Seniors Mentor, please go to www.cyberseniors.org or call 1-844-217-3057 to register for a one-on-one phone session. We also host weekly tech drop-in sessions from 2 to 3 p.m. Eastern Time on Thursday.